Just
Yes.
checking. My name is Jamie at Love Warrior Hugs, and the most important thing I think about depression is that I am not depressed because of that I have epilepsy. Epilepsy gives me depression. In other words, I don't like it when people say to me, "Oh man, you're depressed. It's because you're epilepsy." I'm like, no, 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 no. Epilepsy and all of its side effects and all of its glory and everything that causes depression. And I work through it. So anyway, how about you, Bree?
I've experienced depression, but like you said, it's more of a combo based on my epilepsy. Like, it's not like, oh, you're depressed because you can't do this. It's like, I just feel in a dark spot right now. And it's like, but I do go to therapy for it. I do take meds for it. I do smoke weed for it, but it goes away. Mine's not a constant thing. Like, I'll have days where I'm really sad, but that's not the same as depression. So I've been in a depression, and I would say Keppra made me very depressed. I had a horrible, horrible, horrible time with Keppra. So now though, I have sad days, but I don't really get depressed very much, more so anxious, but we'll get that later next week. But yeah, I guess that's my take on it. It comes and goes, I guess you can say.
Grace, what do you think?
I would say pretty much the same thing. Like, I have bouts where I'm sad, but I wouldn't necessarily call it depression. I would say, again, I'm more anxious.
Okay, Nito. You got to unmute yourself.
Yeah, I just did. I think my depression, it goes with a little bit of both my past and then the seizures and surgery. I've had brain surgery and just like you said, epilepsy and everything that's come along with that.
So the next thing I wanted to talk about it, and Bree kind of alluded to it, is how our medication, a lot of the side effects can be depression, and some more than others. So, I don't want to call that fun. Call that just, hard to deal with. Bree mentioned Keppra, not a fan of that one. Fycompa, also, that gives you a whole nother level of every experience in your body. And I also did not like Depakote. Now, everything works for different people. Different, cocktails work for different people. But those are the ones that cause me to have the most emotional and sometimes the worst, depression that it is. And if you'll notice, whenever they advertise anything, it's always may cause depression, like the PS of everything. What about you, Bree?
I would say the other one that really kicked my ass was Topamax. Topamax made me a zombie, made me very bleh about stuff. Maybe we can cover this in a sec, but I've noticed my grand malls make me more depressed than my absence seizures, oddly enough. But I do take, what's it called? Not Latuda, not Lyrica, what the hell? Lexapro, thank you. Lexapro to combat the seizure meds. The side effects. I don't have any side effects from Lexapro, but it just ups my mood a little bit. It puts a little serotonin in where it should be, type of thing, that kind of lacking from, like Nito said, has surgery and blah, blah, blah. I've had 3 in 6 months, so my brain's spent.
Just a question. Do you know the generic name for Lexapro?
Let me lean this way. Hold on. All right. Escitalopram, something like that.
Okay. I just wondered because I take Citalopram, and I have no idea what I call the real name for it is.
Yeah, the brand name.
Yeah, the brand name. Mm-hmm. Grace, what would you say? Medications.
Really had meds that made my mood drop. I would say I had some Keppra rage when I first started it, but I've been on it for 5 years and it's definitely gotten better. I was really bad on Lamictal because it gave me insomnia. So I was exhausted all the time, and of course that led to being feelings of being sad and really upset. But again, it was more so just sad and not depressed.
All right, Nito, you're up. What kind of drugs and what do you think about it?
It's just like Bree said, I had a bunch of surgeries in a row, and medicine affects us all differently. You know, and men have estrogen and testosterone at the same time. So sometimes I feel like my estrogen raised after my surgeries. Not that I walk around, you know, like my body's changed, but and I don't mean that. That came kind of weird, I guess. But you know, it's now that I feel like my emotions are different now, where I'm affected and I react to things a little differently. And Topamax, Lamictal, they work fine. I mean, I'm still going to have seizures. And now I'm on oxcarbazepine. Is that what
Mm-hmm.
it's called? Oxcarbazepine? I wish my wife was standing right next to me so I can ask her. But and that works, but it changes my mood where I'm fine. And then the next day, I don't want to be near anybody. And that's where my emotions come in. But I can't cry anymore. I don't cry, but I just want to cry. You know, I'm like, "Ugh, ugh," but it's not happening. But my emotions are still there where I'm sad. But it's not happening. You know, but it's Keppra jacked me up. It bumped me up, you know. So, but we're all different. And I couldn't tell you the other medications because I forget things now. You know how that goes.
So, you know, we've established that, you know, how we determine that, like our definition of depression and medication. Then there's also external factors that can, you know, cause depression. I'm a mother of 2 girls, and they are, and they have a lot of rage. They're at the age where they have a lot of rage. And if I can't help them, then I get depressed from that. So, because I want to be able to be there. And some days I just can't. If I had a seizure, or I feel seizure-rific, I can't be there to help. What do you think, Bree? What's up with you?
Mine's more so I do it to myself because I feel like I'm a perfectionist. I get mad at myself for when I can't finish something or can't do something the way I intended it to, and I have to make an accommodation. And like I know I need to not be an idiot to make accommodations for it, but it's like I didn't want it to go this way. I wanted to finish this. Like I should have had my doctorates already, like working towards it type of thing. So I'm like thinking back on that stuff. I'm like, it pisses me off. It makes me depressed. Or like, you know, my whole family works and my brother and sister and mom all work. I'm at home, you know, my sister's disabled too. My brother's disabled, but they can work and I can't, you know, so it's like a kick in the ass when you see your younger siblings, you know, I wouldn't say thriving, but living a quote unquote normal life kind of.
Mm-hmm.
So that's been like the one that I'm like, well, now I'm used to it. But like some days I'm like, damn, I just really wish I could just take off and go drive away from these people, you know, but I can't.
You said it out loud. That's cool. Grace, what do you think? External factors bother you?
I'm kind of the same way. Like I can't drive too. I live in the middle of like nowhere, basically. So that's kind of it. Like I want food from the store, but I have to ask, and it's like, well, wait till I go to the store again type thing. Again, my younger sister, you know, driving, and I have to ask her to take me places, or feeling guilty because I have to ask people to take me places, especially, you know, now we can't really leave the house, and it's like, but I need medication, so somebody has to leave the house and, you know, put themselves in jeopardy for me, and that, you know, makes me feel pretty crappy.
Mm-hmm. All right, Nito, what would you say? External factors that make you sad?
The external factors is my ability to remember now. You know, post surgery and I had a stroke right after my surgery. Is I can't remember. You know, I'm a math teacher and I have to teach myself geometry right before I teach, you know, 3D figures. I can't do that anymore. Whereas I didn't have to look at anything to teach stats or teach my seniors. Now it's almost embarrassing that I have a 3x5 card to teach something now. And, you know, I was kind of cocky about it before. And I have a great family. I have 4 kids. I've been married since I was 19. My wife was 18, and I'm 43 now. And I was kind of a prideful kind of I don't want to say I was a douchebag. I was.
At least you can admit it.
Yeah.
I think I'm a pretty likable guy. I was just, I can befriend anybody, Befriend, does that mean you can get friends?
I don't know,
We'll go
but
with it.
I'm gonna cut you off. That's part of being the moderator, because we have about 15 minutes left. And I would like to have the other people that are on the call have a chance to ask some questions. In order to do so, you want to turn on the chat function, which I don't know which way you've got, if you have a computer or anything, but if you touch somewhere on the screen and you see that it's like a more, and there's 3 dots, okay, you'll click on the more, and then it should come down and say chat, okay? Now,
It could also be along the bottom of the computer screen.
yeah,
Yes.
if you touch anywhere, it should come up. So like you can type your question in, and then I'm not in charge. Thank God I'm not in charge of electronics. We will call on you accordingly, like by the way that you go down. Okay, cool.
Yes. So whoever wants to talk or doesn't want to talk, you don't have to. You can just listen, but this is your chance, type of thing.
Okay. Who wants to ask the question first?
Or talk.
Or
Start
talk.
at the bottom. All right, now we're here.
I've cut those guys off. Are you sure?
I know, we're just quiet.
That's fun. It's like having my kids and being like, you're done.
I know.
Yeah.
If
Josh, do you have any questions regarding, or anything, statements regarding depression?
He might be
Did you
having
hear?
problems.
Oh, Josh, can you hear me? Shake your head, yes or no. Yes? Okay.
Okay. You might be muted yourself.
Oh.
I'll
Well,
unmute everyone so that anyone who wants to.
Okay, coolio.
Okay, there we go.
There we
Sorted.
go.
Yay!
Happy
Do you have anything?
days. Basically, like my depression is just sort of it's an all the time thing. It basically comes from sort of when I was bullied, pretty much from the age of 7 or 8, right the way through to 16.
Mm-hmm.
All the way through school, it hasn't really gone away. Like I went through a load of counselling sort of towards the end of it, sort of from the age of about 14. And it was a group over here called the Child and Adolescent Mental Health Service. And I basically hit the age where they stop sort of helping you. So I got transferred over to the adult teams. I didn't like the adult teams.
It's very hard. I mean, I have a daughter that's like right there. And so you're so comfortable with the pediatrician, then it's like, bye-bye.
Yeah.
Other people. Somebody just typed in a question. Grace, can you read it?
Milius, how do you guys stay motivated when trying to balance medication side effects like depression with things like school or work? So I graduated college, and then I went to, I started working at a school, and it was terrible for my mental health. I had no motivation whatsoever to go in, which was really sad because I loved what I did, but my body was just like, no. And because of how I felt, I started having lots of seizures and migraines. So I had to balance it like, well, I can't work here, but I was able to find a job that I could do online. So it's kind of like finding other ways to do what you like, at least for me.
If you have the opportunity to do so.
Mm-hmm.
So the only other person I think that works is Nito. I'm the oldest on the call, which makes me awesome. So I worked for a very long time, and finally my epilepsy doctor was like, that's causing you too much stress. So I was very fortunate enough that I could stay home. But having kids is work too, right, Nito? So how would you answer that question? I'm calling on you, Nito, math teacher.
I know I have to read it again because I'll forget. Motivation. To me, I just don't. I can't lose. I have to keep going ultimately. And if when you have 3 kids and a wife, from my perspective, and I didn't know I had epilepsy till I was 30, even though I had it all my life. It was just intense anxiety all my life. Even going to the military with anxiety, I just had to. And the medication, like I said earlier, has caused those side effects even to get worse. And I think medication, and you guys that are younger than me, and Jamie will see that ultimate. And I don't know with Jamie if she's understood this, and if you guys too. Ultimately, you're going to have to change your medication because as you get older, your chemicals are going to change, and they're going to have to change it. You're going to keep having seizures. So what I take now, had to up it, oxcarbazepine to 8 in the morning, 12, and before it was 9 in the morning and 10 at night, 10 milligrams. So, I mean, that's going to affect your medication side effects too. And depression, I mean, we have to do stuff like this to fix that depression as well,
Well, and for you young people, what happens sometimes is your body just gets used to it, and it's like, bye, I'm sorry, try a new one. And so then, if I could give anybody advice, find something that they can take blood work on to see what your therapeutic level is, because then is it still working? Do your other medications affect it? Like you said, time of day or whatever. But I've had several medications. I've had epilepsy for 25 years that have been like, oh, sorry, we don't work anymore. And then
Me too.
Yeah. Okay. Any other questions?
Since I don't work, I'll put on kind of what he said about how to balance it. Like he said, I just take it as like I'm too stubborn to give into this stupid ass thing that decides to act up every once in a while. Like I'm like, nah. I'm like, I can be a bigger bitch than epilepsy. Let's say that. So I just won't give into it. I'm stubborn. It's how I was raised. I was raised in a Jewish household. Like everything, I'm supposed to meet milestones. I'm like, I'm supposed to be a doctor. I should not settle for less. So it's like, no, I need to be normal, not settle for less. That's kind of how I go through it. So I'm just stubborn. That's my answer to it. I am too stubborn to give into something that I can manage.
That is hilarious.
we call it the new kind of normal, right?
Just to sort of add on to that sort of question, I mean, I've just come out of literally in the process of coming out of a job at the moment. Sort of the stress and things from that, just it kind of just got too much for me. Like it just built up. It sort of, I mean, in the last 3 days, I think I've had about 8 seizures. And yeah, there's been a couple of small little absences, absences.
Yes, absence.
Petite malls.
The little ones where you blink and then you're done.
Yeah, pretty much. But it's still sort of, the stress is still there, and that stress is still affecting sort of depression. I mean, I know, was it last night, Grace, when I spoke to you, when you messaged me, it was like the depression. It was, I just turned around and said, it was kicking my ass, basically. I didn't even know whether or not I was going to be waking up this morning. Let's put it that way.
Oh, that's a good question.
Kay, you had a question? I couldn't read it all.
It said, basically, did anyone ask first what came first, the epilepsy, like the chicken or the egg, the depression or the epilepsy? What do you think came first? For me, I think the depression came after the epilepsy, because I've had not a great relationship with my father my whole life, so I've always been kind of an emotional wreck. I will admit that, but nothing ever to be what I felt like in my downward spirals of epilepsy. So I want to say that the activity of my brain mixed with the meds has really contributed to that for me anyway. I'm sure everyone's different, but mental health also does run in my family. So I could have just been, ignoring it this whole time. I don't want to say, and being stubborn and avoiding treatment. So I don't want to say for sure, but I feel like I noticed it more after my seizures and stuff.
And I'm the same way, like, because we know that I was born with whatever is causing my seizures, or I know what's causing my seizures. So I feel like the diagnosis, like almost finally knowing why I was acting the way I was, kind of triggered this, oh no, kind of thing. Made me feel like, is there something else I'm missing? Is there something, kind of going down into this spiral?
Josh, you brought up a good point though. I think when we have seizures, everybody feels a little bit different. Okay. I'm really angry, mad at myself, but then later I'm depressed because it happened. So I think that that's something, to address. It sounds like Bree and Grace, you said that. Nito, do you feel the same way?
Mm-hmm. Definitely. I do.
Mm-hmm.
And I'm not sad, and I never really felt that way until I started having more and more.
Mm-hmm.
Mm-hmm. And I felt more trapped as it got more severe in my case. I felt more like, oh shit, this is really not going to go away. Like, I was diagnosed at 19, so they told me that you can grow out of it within the next 7 years. Nah, not at all. It got worse. So,
yeah, it got funny.
Yeah, it got fun. So,
Right, I hate to say this, but we have 3 minutes left, so we should probably start wrapping up.
Yes. So this is why we're going to extend the further ones for an unlimited time, because this is getting, especially if we get more people.
Mm-hmm.
Right. Mm-hmm.
So this is just an official trial run to see the time limit too, but also a serious one.
This is the last thing I'll say. As a moderator, just want to thank everybody for being on here. And it's been really nice. And hopefully people will feel like they can ask more questions later. And this is an overall statement. And I think everybody will agree that things that are really hard from a depression standpoint are the things we can't do. And that, shake your head, that is hard. You can no longer do that. Maybe work, drive, swim, just name them.
Yeah.
So.
I want to say with depression, I don't want to say it's normal. I want to say it's common. I don't want to say, like I said, feeling depressed is not normal, but it is very common with people with any sort of anything going on in their head or without it. So you're not alone in being depressed, but you are alone if you decide not to get help. So
and there are depression medications that you can take. Ask your neurologist. There's not a ton, but they do help. I call them my happy pills.
And some of them are, sorry to cut you off, are also anti-seizure meds. So you can use both for treatment.
Oh, go ahead, John. What were you going to say?
Yeah.
I was going to say, I'm on for the depressants, the sertraline. I found it doesn't mess with my seizure pills. It works absolutely wonderfully. I'm not sure about everyone else.
Yeah, mine doesn't affect mine either. Mine, the person that diagnosed me works with my epilepsy team to give me meds, so nothing coincides.
I'm going to go ahead and stop recording.
Okay.
Thank you, everyone.